Hello and welcome to West Texas VA Healthcare System's Vital Signs Podcast. I'm your host, Michael Cole, and we're here to talk to our veterans out there in the West Texas area and talk to you about what's going on at your VA healthcare system. Try to get some information in your hands to help you better help yourself as you come and take care of your healthcare needs with us here at West Texas VA. And today, one of the big parts of the West Texas VA healthcare system is our community care network and all of those partners out there that we rely upon to provide some of those more intricate or specialized healthcare services that we may not be able to provide directly. And that's why we have a special guest with us here today. Miss Leticia Ruiz is our interim administrative business manager for community care. Thanks so much for being here. Why don't you just say hello and tell our folks out there in our listening world who you are, what you do, and where we're going.
Hi, my name is Leticia Ruiz, and I am the interim administrative business manager for here at West Texas VA. I've been here for 12 years.
12 years. And what have you done in a rough sketch over those 12 years?
I've done a clinical, I've done an administrative, I've been doing several roles, but I think I finally found my calling.
Well, that's great. And not only that, having all that experience, you obviously can navigate some of these more complicated systems like community care.
Correct.
And that's a great thing. And that's why we're going to be talking today about the very basics of community care. Me being a veteran myself, I know West Texas, if I needed to go see some sort of specialist, I'm going to come in and I'm going to see my PAC doctor here at the Big Spring campus. And he said, maybe I have to go see an allergist. Okay, we probably don't have an allergist on staff.
Correct, we do not.
So they would probably have to send me out in town.
Correct.
What happens?
Well, once your PCP sends that referral for community care, we have admin staff that review it for eligibility. And once the eligibility is reviewed and if it's approved for community care, then the scheduling process starts.
And what does that scheduling process look like? What should I expect as the veteran, and what responsibilities do I have as the veteran through this process?
Well, the first step as far as scheduler is going to be to contact the veteran, make sure that they're aware that they have the referral. And once they're communicating and check scheduling preferences and things of that nature, all that information is gathered. And then the next step for the scheduler is to look for a community care provider that accepts VA referrals. As far as the responsibility of the veteran is basically to await a phone call from the community care provider's office coordinating that appointment.
And how long would that normally take? Okay, I saw my primary care provider this past Monday, when everybody was freezing and no water was working, no electric was working. But I saw my doctor anyway. When should I expect a follow-up from community care?
You should at least expect some kind of a follow-up within the first week.
Okay.
Some kind of contact saying something to the nature of, do you know you have this referral and what are your preferences?
And then from there, it's pretty much going to be, you all have to find a doc that fits the bill.
Correct.
And is in our network.
Correct.
And then start working that schedule from the doctor's office side to work with the veteran schedule.
Correct.
So pretty much the next information we might receive from your office is, okay, we've scheduled you for this date with this doc at this location.
Not necessarily from us. It'll be all from the community care's office because, again, we don't know that what their appointments look like, what their availability looks like. They will be contacting them and coordinating that appointment.
Gotcha.
The responsibility from the veteran is to inform the VA, I got my first appointment. This is what it is. And there's a call center that they can call into and give that information.
And what number would that be?
That would be 432-263-7361, extension 7270.
7270.
Correct.
So as long as you can remember the extension, we're pretty good because the rest of the phone numbers out there everywhere. So they should, once they hear from that specialty doctor, like me, okay, I'm going to see my allergist. The allergist called me and we agreed to a certain date and time. Then it would be best if I contacted your office and said, hey, the doc reached out. This is our date and time. This is when I'm going to go see the doc.
That would be the best.
Okay. And after that, what other interactions are going to occur, what needs to happen. How do you guys get the record? How does my primary care doctor get the records from the community provider?
There's various ways. We have different methods of exchanging information. They can do fax. They can do health share record management, HSRM, which they can sign up for. They can do joint legacy viewer, which they can also sign up for. They can do mail.
But that's all the providers.
That's all the providers.
So, but if I get a copy of what that doc writes up, can I bring it to you?
You can definitely take that to your local facility
and hand that in. And then what if there's, okay, let's say I see my allergist I now have an allergist, and they say, oh, we're going to need to run some more tests, or we're going to need to do this, that, or other thing requiring follow-up appointments. Am I cleared to go do all that without any more
Correct.
input?
Yeah, so once the first appointment is confirmed and the veteran communicates that to the VA, we then in turn send them an actual active referral to the community care provider's office, and that gives it so for that length of period. That could be 90 days, 60 days, a year. During that time frame, then any type of care that needs to happen in between that authorization period can happen without any type of coordination any further as far as...
No more approvals needed, or what if they want to put me on some special allergy medication out there that is not in the VA system?
Well,
I probably put you on the spot with that one, because it just occurred to me. I think I've heard that before from other veterans. Hey, this doc wants to give me this medication, but it's not in our system. Now we have to get our pharmacists involved.
Yes, you do. And there is a particular, I want to say, website that gives you all the medications that you actually can do.
The formulary. Mm-hmm.
Correct. Yes. And honestly.
And if a veteran has questions of that nature.
Yes.
Probably would be best if they were to pick up the phone, give your office a call, or even send a secure message to their primary care provider.
That is a good, yes.
If you're not using My Healthy Vet, if you're a veteran out there and you're not using My Healthy Vet, you really need to look into that. I love it. I can jump on my phone, I can jump on my laptop at home, and I can send a secure message straight to my primary care doctor.
Yes, you can.
And I usually get a response within 24 hours. They say 48, but I usually get one within 24. Yes. And that would be a perfect venue, so you don't have to come to the clinic. You don't have to get on the phone and work through the switchboard.
Correct.
You just shoot them a note. So all my doctor's appointments are done now, and all of a sudden I get a bill in the mail for more than my mortgage payment. What should I do?
If you happen to get a bill, there is a national call center that handles the claims now. It's no longer locally. So they would have to get all the information, whatever documents that is, and they will ask over the phone, what's on your document. If they need to present it to a VA facility, they can do that as well. But really, whenever they call that 1-800 number, they have to be prepared with that information. They have to be what date of service, how much is the bill, what provider's offices is billing you, things of that nature. So they really have to give that information over the phone when they call that 1-800 number.
And that 800 number, it's actually 877 number. It's 877-881-7618. So if you end up getting a bill, give that number a call. Again, it's 877-881-7618, and they can help you take care of that. And again, like Leticia's telling us, you can bring that bill into any one of our facilities, and the folks there can help get that in the hands of the right people to make this happen. Because these folks on the 800 number are probably going to want some of that paperwork, I would imagine.
Correct.
So that's how you can get that through to them. Again, community care, it's a big part of our network out here in West Texas. It's our responsibility as veterans to understand how that system works so we can work better within the system. Not unlike military days, you knew the system you had to work within. You understood the different parameters, the left and right limits. Same thing with this. Figure out how it works, understand the players, and then use them. Use them the right way. And that's why we have you here, right?
Yes.
So you can help us.
I can help them navigate whatever they need to navigate.
And again, what's that number to call if they need to get through to you?
To me, it's 432 263-7361, extension 5740.
So there's your basics on community care. We're going to be doing more of these episodes down the road and get more and more into these as we start building more of a library of informational products for our veterans out there in the West Texas VA. Thanks so much for taking the time to listen. Thanks so much for joining me. I really appreciate it.
You're welcome.
Even I learned, I didn't know there was an 877 number, so I had to jot it on a piece of paper because this will go in my wallet. It'll go in my cell phone, and I will keep it handy. Thanks again for being with us. Thanks for listening out there. If there's a topic you want us to cover for you, or there's questions you have, please put them in the chat session down below. Let us know. Give me a call. We'll get them answered right here by the subject matter experts, because trust me, I'm not that person. And we'll get those information out to you. Again, it's Mike Cole with Vital Signs Podcast for West Texas VA Healthcare System. Thanks so much for joining us.